And in a hind limb, this may be either in the aorta, in the iliac arteries, or in the femoral arteries due to thrombosis. In a hind limb, we tend to see, after a period of exercise, the progressive onset of severe lameness, which may extend to becoming non-weight bearing. If you stop the horse immediately after exercise and examine the limb, you will see marked differences compared with pre-exercise. So in the left-hand image, we can see normal distension of the saphenous vein. In the right image, we can see that the saphenous vein is not distended. This was when the horse was showing symptoms after about 15 minutes of exercise. In association with lack of distension of the saphenous vein, if you assess the pulse amplitudes in the lateral metatarsal artery, this will be substantially reduced. The distal limb temperature may also be reduced. The horse may repeatedly stamp the affected limb as though it's got pins and needles. Acute onset severe lameness during or soon after exercise may be due to exertional rhabdomyolysis, and this can occur in a number of different forms. You can have a unilateral, most commonly hind limb lameness, but occasionally forelimb lameness. There may be a bilateral hind limb lameness and a progressive inability to move. There is variable distribution of the muscles which are affected and the degree of distress experienced by the horse. Palpation of the affected muscles may reveal that they are excessively firm and may be painful on palpation. Spontaneous fractures are relatively common in racehorses, but do occur occasionally in non-racehorses, resulting in acute onset severe lameness, as was seen in this horse on the right, which has sustained a comminuted articular closed fracture of the proximal phalanx, which occurred when the horse was chased by a dog, galloped off, the rider fell off, and the horse was found non-weight bearing about a kilometre away from where the dog started chasing it. There may be a history of trauma, for example, a fall, hitting a fixed jump, a collision, a kick, entanglement with a gate, and common injuries include fracture of the supraglenoid tubercle. If a horse hits a fixed fence when jumping with a hind limb, we not uncommonly encounter a fracture of the patella, which may only be seen in the skyline image, as shown in this image to the right, or a fracture of the lateral trochlear ridge of the femur, or a fracture of the tibial crest. Occasionally, fractures of the patella coincide with lateral trochlear ridge fractures as well. A kick injury may result in fracture of the olecranon of the ulna, and obviously there are other locations where fractures may occur as a result of direct trauma. If there has been a kick injury or skin trauma on the craniomedial aspect of either the antebrachium or the crus, I think it's vitally important to consider, even if the horse is only moderately lame, that there is a significant risk of the horse having sustained an incomplete fracture of either the radius or the tibia, as exhibited on the radiograph to the right.